Good afternoon, everyone, and welcome to today's special edition telebriefing on storm and flood recovery resources. We will get started shortly. We want to give another minute or so for folks to log on to the meeting. Welcome to today's telebriefing. I'm Liz Welbrock. I manage the community and faith-based organizations and rural communities sector with the Office of Strategy and Innovation at the County of San Diego's Health and Human Services Agency. Thank you for joining us today. We have a fantastic lineup of panelists today who will provide us insight on storm and flood recovery efforts throughout San Diego County. Now, a few reminders before we begin. This meeting is being recorded and your lines are muted. Please remember to submit your questions in the Q&A box, which is a button at the bottom center of your screen. And if due to time constraints, we don't get to your questions today, or you want to reach out to our team, you can follow us through the email address listed on the screen and share it in the chat as well. We will also be sending out all answers to questions in an email follow-up. If you'd like to receive the recording of today's telebriefing, please sign up for email updates by clicking on the link shared in the chat. For simultaneous Spanish translation today, please click Interpretation under the meeting controls. The goal of this telebriefing is to provide important, relevant, and accurate flood and storm recovery information to provide our community and assist local organizations serving those impacted. Today, we'll start with some introductions, followed by resources from the Federal Emergency Management Agency and departments from the County of San Diego, including the Office of Emergency Services, Homeless Solutions and Equitable Communities, Behavioral Health Services, and Self-Sufficiency Services. We'll close today's meeting with a Q&A discussion. Our moderator for today's discussion is Chuck Westerheim, the Emergency Services Communications Officer. And now I'd like to pass it on to Chuck to introduce our speakers and moderate today's resources and recovery discussion. If you have any questions for them, please put them in the Q&A box to be addressed. Thank you. Over to you, Chuck.
All right, thank you, Liz. The pleasure to introduce a great panel. Pam Glashroeder is Individual Assistance Liaison from the Individuals and Households Program from FEMA, the Federal Emergency Management Agency. Stephen Ray is the Assistant Director of the Office of Emergency Services. Matt Brown is the Chief of Agency Operations with the Office of Homeless Solutions within the Department of Homeless Solutions and Equitable Communities. Maria Morgan is the Assistant Medical Services Administrator, and Kat Briggs, Chief of Agency Operations both with Behavioral Health Services. And Alberto Banuelos is the Assistant Director, and Esma Elliott is the Deputy Director of Self-Sufficiency Services. Now we begin with the resources discussion with Pam from FEMA. Please remember, if you have questions for them or any other speaker, please put them in the Q&A box to be addressed. With that, we'll start with Pam.
Thank you. I am here to present you a little bit of information on individual assistance. So if we can go to the next slide, please. So the first thing we want to do is let you know how to register for assistance. Registration can be done in several ways. You can call our helpline at 1-800-621-3362 or 1-800-621-FEMA. You can go in person to one of our disaster recovery centers and apply there. We also have people out in the area canvassing neighborhoods called our disaster survivor assistance teams. So you may actually interact with one of those individuals. In addition, you can use our internet services at disasterassistance.gov or our mobile app. Now, it is very important that you register for assistance before the application deadline on April 19th. And then we will be providing assistance for up to 18 months after the date of the declaration, so until the August 19th of 2025. Next slide, please. So we do have some general conditions of eligibility that I'm going to go over very quickly. First of all, the applicant needs to be a U.S. citizen, non-citizen national, or qualified alien. We also will take the application in a minor child's name. If the minor child is a U.S. citizen, non-citizen national, or qualified alien, and they can apply on behalf of the household as long as the parent or legal guardian who's applying lives in the same household. We do check identity verification. This is to protect our applicants from any type of disaster fraud. So we will be checking identity for all applicants. We also need to verify occupancy and that the dwelling that you're registering for is your primary residence. Now, some important information to know is that this disaster was declared for severe storms and flooding, which occurred January 21st through January 23, and not any of the storms that came before or after. In addition to that, even if you have insurance, you are encouraged to apply. FEMA may be able to assist underinsured or underinsured disaster-caused damages and serious needs and expenses, even if you have insurance. Next slide, please. So FEMA has what we call our Individuals and Households Program, which has two main categories: housing assistance and other needs assistance. Housing assistance is composed of rental assistance that you may receive if you had to relocate from your dwelling because of the damages. Temporary lodging assistance. This is a hotel motel reimbursement program for a period of time before you receive that rental assistance. And if you're an owner, you may receive either repair assistance or replacement assistance on your home. Our other needs assistance program consists of personal property and transportation assistance. Now, these two assistances, you may be referred to the Small Business Administration first and then come back to other needs if the Small Business Administration can't help you with those. And then we may be able to assist with disaster-related funerals, medical or dental assistance, which assists with disaster-related losses of medical or dental equipment or any type of disaster-related injury. Child care assistance if you've had an increase in cost of child care because of the disaster. And then we have disaster-specific miscellaneous items such as a weather radio, a wet-dry vacuum, or a generator. Now, each of these categories is limited to a 42.5 cap. That 42.5 maximum is applied separately to housing assistance and other needs assistance. So we do exclude from those caps rental assistance and lodging reimbursement and any ADA or American with Disabilities Act line items that we may have. Next slide, please. So in order to appeal, if you disagree with the decision letter that is sent out to you, you must appeal within 60 days from the date on the letter. You need to do this appeal in writing and it must be signed. Appeal letters do need to have substantiation with them, such as insurance settlements, receipts, contractor estimates, or mechanic statements. When you submit your appeal, please include your FEMA registration ID and our disaster number, which is DR 4758, and then you can upload your documents to your online account, take them to a DRC or fax or mail them. Next slide, please. So very quickly, there are some other programs that FEMA may be able to assist or that assists with. We do not actually manage these programs, and they are programs like crisis counseling. The goal of that program is to aid survivors in recovering from the adverse reactions to disasters. Disaster legal services, which may provide legal assistance to low-income survivors affected by the disaster. Disaster case management, when approved, will help manage the longer-term unmet needs through disaster recovery planning. And then the disaster unemployment assistance, which is actually open and has a filing deadline of April 2nd. That is all I have today. So back to you, Chuck.
All right, thank you, Pam. So our next guest is Stephen Ray. He's the Assistant Director of the Office of Emergency Services. Stephen, take it away.
Yeah, thank you, Chuck. Happy to be here. Happy afternoon, everybody. I wanted to start off by talking a little bit about our Emergency Operations Center. As I go to community meetings, I notice there's a lot of confusion about what that is and what that term means. Really what it is we set up a framework for people to come together, like you see in the photo there, that we can all work together, all in the same room on different projects and make sure we are all coordinated. We not only have county folks in that EOC, but local agencies in there, including volunteer agencies, as well as state representation. So what kind of things do we do in the EOC? One of the big ones is information management. It's been one of our missions to try to figure out exactly where the damage has occurred and how many people are affected. We also now are working with our partners at the federal government. As they work on this issue, we share data between each other. Managing resources is a big one. As we see resources become available, we want to use those as efficiently as possible. For example, maybe as soon as the flooding occurred, one of our resources is the Red Cross, and they will open a shelter for us. Another resource might be the local assistance center that we can set up right away to immediately help the flood victims. As new resources appear or get approved, we do our best to manage those in the most efficient way possible. We do community support services. I think of this, when I see this, I think of this as people out there who are on the street helping out the volunteer organizations. How can we support them, whether with warehousing or materials or equipment that they may need? That's the areas that we focus on. We are here for the long term, so long range planning, thinking ahead, trying to figure out what the next steps are. And also the last bullet point there, emergency proclamation. This is an important piece of the puzzle that gets help coming from outside of our county. That emergency proclamation, when it is approved, we get state aid and we also get federal aid like we have for this particular flooding disaster. Next slide, please. This is a timeline or a snapshot. And as you recall and can see on the slide, on the day of the flooding disaster, the American Red Cross set up a shelter location to support the impacted residents. That same day, the county issued a proclamation of local emergency requesting state and federal disaster assistance. The following day, the governor declared a state of emergency, and in February, the Biden administration approved a major disaster declarations. These actions bring state and federal assistance to supplement local recovery efforts. To link residents who were impacted by the storm to critical services, the county opened a local assistance center 6 days after the storm, where over 38 government and non-governmental agencies offered services to residents. The local assistance center was at the Spring Valley Library, and we served over 1,300 families. County staff were on site at the city's local assistance center, providing connections to services and assisting an additional 1,068 families through that city's assistance center. The County Board of Supervisors previously approved $10 million to fund relief efforts and approved short-term non-congregate sheltering programs to provide emergency temporary lodging for residents and those displaced in the storm. On February 12th, the county's emergency temporary lodging program started, and you'll hear more about that later in this presentation. Next slide, please. One of the hardest things for us to really understand is what areas were damaged in our county. So on January 23rd, the county deployed an online self-reporting survey for residents and businesses to report storm damages to us. The county received 3,431 surveys, which allowed us to better understand the scope and scale of the damage and identify the hardest hit areas in the community. Our ability to quickly get damage reports from residents helped us direct voluntary organizations where to focus their efforts. It also helped us make our case for that state and federal government assistance. On January 29th, a joint preliminary damage assessment team. This is comprised of a county, state, and federal employees. They began their official visits to approximately 889 residents and businesses to verify damages. And more importantly, this is done to try to secure a major federal disaster declaration for individual assistance. FEMA individual assistance, that program means dollars to individuals to help them recover. Of the 889 sites visited, the team determined that 595 of them had major damage. Next slide, please. On March 1st, 2 FEMA disaster recovery centers opened in the Spring Valley Library and Mountain View Community Center at the Disaster Recovery Center. Individuals can learn about the ability for disaster assistance programs, learn about small business administration programs, and get referrals to other assistance. As of March 10th, more than 4,000 San Diegos registered for FEMA individual assistance, and FEMA has approved over $12.5 million for housing and other needs in San Diego County. FEMA also works with the U.S. Small Business Administration to offer low interest loans to homeowners and businesses. As of March 10th, FEMA has referred more than 3,000 individuals and business owners to SBA. More than $500,000 in loans have been approved. Next slide, please. During disaster recovery, the county worked closely with VOAD, or Volunteer Organizations Active in Disaster. This group connects a network of volunteer groups with the community. Volunteers have been helping with muck outs and cleanups of flooded homes, mold suppression, and help replace appliances, furniture, mattresses. 7 community organizations have been involved in crisis cleanup, providing assistance to 121 households so far. To date, $1.3 million has been raised through the San Diego Foundation's San Diego Flood Response Fund. Over $1 million has been granted to local nonprofits, organizations providing assistance to those impacted and displaced by floods. Let's go to the final slide for me, please. I wanted to talk a little bit more about VOAD. The VOAD group serves as a central hub to guide and support people with issues related to the flood. VOAD recently received a contract from FEMA for long-term case management of people impacted by the flood who have unmet needs, and will be able to connect community members to flood assistance and other resources. Long-term case management is a time-limited collaboration between trained case managers and disaster survivors to create something called a long-term recovery plan. This plan includes resources, decision-making priorities, as well as providing guidance and tools to assist disaster survivors. Chuck, that's my presentation. I'll send it back to you. Thank you.
All right, thank you, Stephen. Next up is Matt Brown. He works with the Office of Homeless Solutions within the county. Matt, take it away.
Thanks, Chuck. The county has been working to address the need for temporary lodging for people impacted by the flood by standing up non-congregate sheltering through a unique emergency temporary lodging program, also known as ETL. Traditionally, congregate care has been how disaster survivors have been sheltered. Non-congregate emergency lodging is very rare and has only been used a handful of times in California. As Stephen said, on June 30th, the Board of Supervisors approved a short-term, non-congregate sheltering program to provide up to 30 days of lodging for residents displaced by the storm, with an extension available based on household circumstances and allocated $10 million to fund the relief effort. The county's ETL program launched on February 12th, and as of March 8th, the county, through contracted staff, have placed 846 impacted households at 65 local hotels. Over 1,220 households were initially identified as being potentially eligible for the program after outreach at local assistance centers, self-identified through a survey, calls to 211 asking for assistance, or identified through community partners who have been helping displaced households. To be eligible for the program, individuals confirmed that they were either an owner or renter of a residence that was uninhabitable due to the January 22nd flood. To connect with individuals impacted by the flood, the county worked directly with various community agencies, including the Southeast Disaster Response Team, the Jackie Robinson YMCA, the San Diego County Office of Education, the San Diego Housing Commission, SBCS and the City of National City, and the Chicano Federation. The Department of Homeless Solutions and Equitable Communities also led 45 on-site events at 12 hotel locations over a 21-day period. This team of county staff, including community health workers, worked alongside community leaders and contracted staff to provide critical resources and connections to services, as well as conducted intake screenings to establish program eligibility and enrollment. We would like to thank the many community organizations and partners that have been on the ground providing critical support and services to residents who were impacted by these floods. We'd also like to thank the countless county employees who've been assigned to, are actively supporting, and will continue to support this recovery operation. Next slide, please. On March 12th, the County Board of Supervisors authorized an additional $6.6 million that will assist to fund the program for an additional 60 days. Community members impacted by the flood have been provided temporary lodging and case management via contractor to identify needs, establish a long-term plan towards returning to their residence, or identifying alternate permanent housing, and to obtain documentation required. Documentation required by the county will be utilized to inform policy and seek reimbursement as appropriate to maximize funding for the region. As FEMA individual assistance is being approved, including rental assistance and reimbursement for hotel costs, our county team is reviewing the ETL program participant list to ensure there's no duplication of efforts. Individuals that we have confirmed have received FEMA housing assistance will be transitioned from the county program. Through active case management, the county will work with the current program participants to develop a transition plan from the county program, which will include connections to temporary resources and access to alternative pathways to housing for which they may be eligible. Those in the program have been connected to other county resources at various stages and are encouraged to continue to leverage those resources as they transition out of the program. Back to you, Chuck.
All right, thank you, Matt. We'll next go to our partners at Behavioral Health Services, Maria Morgan and Kat Briggs. Maria and Kat, take it away.
Thank you, Chuck. Appreciate everyone being on this afternoon and allowing us to share on behalf of our department about our behavioral health services available here to the community. And thank you, Maria, for joining me as my colleague. Wanted to just briefly share, so behavioral health services as a department is our specialty mental health system here in the region. And we primarily serve people with serious mental illness, as well as those who are living with a substance use disorder. With respect to the recent severe storms, we've provided on-site support services at the local assistance centers. So the one set up in Spring Valley, as well as the one established by the city of San Diego. I also want to share that we've also continued our ongoing services at our county outpatient behavioral health centers, which I'll share about a little bit more in a moment. And then certainly been trying to share out as much as we can with respect to informational materials, whether those are at different shelters, at hotels participating in the emergency temporary lodging program that Matt just referenced, as well as directly with community partners so that we can raise awareness of available resources. In the short time today, I want to go over 3 key resources for everyone on today. Next slide, please. So first and foremost, I cannot stress enough, this is our main resource, our primary resource. If you take nothing else away, please take down the numbers on the slide here. So our San Diego Access and Crisis Line is our local call center. It has been around for over 20 years here in San Diego County, and it is part of the 988 Suicide and Crisis Lifeline National Network. For folks who might not be familiar with 988, or perhaps you heard 988 about 2 years ago, what was known as the National Suicide Prevention Lifeline expanded their services. Oh, past slide, please. Expanded their services to include text and chat, and also added a 3-digit dialing code at that time in the form of 988. But our 888-724-7240 number has been, again, here in San Diego County for over 20 years, and we are part of that 988 network. The services provided through the Access and Crisis Line, it is really a free and confidential resource operated 24 hours a day, 7 days a week by master's level experienced counselors. Language interpretation services are available, so discussions can occur in over 200 languages if needed. And I really want to indicate the 2 pieces here, Access and Crisis Line. So really they can support with assistance finding and navigating services. Even if you're not sure what help you or a loved one or someone you're interacting with may need, please call the Access and Crisis Line. Tell them I'm not sure what I need help figuring that out. Please help me. That is what they are for. The other side of the house, the crisis piece, again, they're part of that National Crisis Lifeline. They have been part of that broad network for over 2 decades. They also do in the moment crisis intervention and support. They also, the representatives at the ACL can also dispatch crisis response services if determined appropriate. So for more information on the Access and Crisis Line, again, if you only take one resource away, please check out the link down below in the bottom left of the screen, as well as the QR code if you're able to zap that. Next slide, please. Okay, so the other 2 key resources I wanted to pull forward. So obviously the Access and Crisis Line, that's telephonic, if that is preferred, or what some folks might be more comfortable with. Again, please start there. They're kind of the doorway, the gateway to getting connected to any of our other services, whether they are offered by us or one of our community partners or contractors. So just taking on the slide from the left to the right, I want to mention our outpatient behavioral health centers. So in addition to having our clinicians deployed to the Spring Valley and City of San Diego local assistance centers, we operate outpatient behavioral health centers for those who are over the age of 18. And that services are available for those who are enrolled in Medi-Cal, Medicare, or for those who might not have health insurance. You see here on the slide, a variety of services are available. So these are brick and mortar locations that people can go into. Again, if that is preferred or more convenient, again, just want to share some options this afternoon. You see there are possible services, group therapy, individual counseling, case management, medication management. Similar to the first slide, that bottom left QR code and that link will take you directly to get way more information on the outpatient behavioral health centers. The last thing I will say on the centers is that they operate based on appointment, but they also take walk-ins, and there are also urgent walk-in hours. So again, if that is the best route to go, please check that out. On the right-hand side here, I want to share, we have a 24/7, so 24 hours a day, 7 days a week, mobile crisis response team program. This serves all ages. I want to share their non-law enforcement team. They're teams of 3. So we have a mental health clinician paired with a case manager and a peer with lived experience. And so they can go out if certain safety criteria are met, and their primary deployment mechanism is the access and crisis line. So again, calling the access and crisis line, that trained individual will help discern whether or not they're the best, most appropriate resource, and they can possibly deploy out to you if you cannot get to a location like a behavioral health center or another one of our partners. They can do crisis stabilization through de-escalation and intervention. They can also help coordinate initial treatment for up to 30 days. So again, please check out the corresponding link and code below. Next slide, please. And then the last thing that I just want to mention, so again, we talked about the phone, the access and crisis line. We have the brick and mortar facilities in the form of the outpatient behavioral health centers. We have a mobile team that can come out to you if appropriate, if you cannot go out. I just want to real quickly mention when I say if appropriate, so it's a non-law enforcement team. We really need to ensure the safety of those mental health professionals as well. So for instance, a medical emergency is going to supersede sending out the mobile crisis team, or if there is a possible threat of violence, same thing, it might not be the most appropriate crisis response. So I want to share that. Also, a mobile crisis response team might respond. They'll do an initial assessment, and perhaps through that initial assessment, they'll identify if a more appropriate resource should be brought in. Lastly, I just want to share on the slide with respect to specifically the program that Matt mentioned, again, the Emergency Temporary Lodging Program. So we have recently, just as of last week, I believe, we've contracted with a community-based organization. Some folks may know them, Open Heart Leaders. They're going to be providing on-site at the hotel locations of the ETL program, group therapy, individual counseling, as well as case management. So we look forward to adding that option for folks. I know it's much needed. And so those, again, will be on-site for those enrolled in the ETL program. And then last but not least, we will continue to share out as much as we can with our informational materials and coordinate as much as we can with our county and community partners. But Chuck, I'll pass it back to you. Thank you.
All right, thank you, Kat. So last in our group of speakers is Alberto Banuelos and Esma Elliott. Please take it away.
Good afternoon, and thank you for the opportunity to join you all today. So Albert Banuelos here, and we're going to talk about the various food support programs that we have currently. So as of today's date, the county staff has helped over 922 people connect to essential services since January 24th. More than 800 households has been approved for Disaster CalFresh, and Disaster CalFresh benefits is a specific program that requires presidential declaration of a disaster area, which we have obtained as previously mentioned. So this is a unique program that is currently in effect. Individuals have until this Friday, March 15th, to submit their application through various formats. They can visit one of our family resource centers, they can visit one of our disaster centers, or they can apply online or by calling our access phone number, and we will provide that information here shortly. So again, this is a one-time payment for individuals that were impacted by the disaster of January 22nd. The requirements to have an ID and just be able to provide us their income and also any expenses that they occurred that are associated through the disaster. And we also, and I will here pass it shortly, or I'm sorry, share it with Esma, our Deputy Director, to talk about other ongoing food services and other programs that are available to the community. Esma?
Great, thank you so much, Albert. So as Albert mentioned, we are operating Disaster CalFresh. However, we did just want to remind residents that here in Self-Sufficiency Services, we do provide additional programs that are ongoing without a disaster declaration that residents can apply for. And the program rules for these programs do change quite often. So even if you have applied before and not been found eligible, we do encourage residents to come back in and submit an application because they may be found eligible. So the three primary programs that we do provide here through Self-Sufficiency Services are our CalWorks program, which is for pregnant women or families with children, and that provides cash aid as well as medical assistance, as well as CalFresh benefits or nutrition assistance. Folks can also apply just for CalFresh benefits, or formerly known as food stamps. And there is certain requirements for that program, such as income limitation, citizenship, and immigration requirements, and county and state residence requirements. Folks can also apply for healthcare through our Medi-Cal program, which is more of an income-based program. So regardless of age, folks can come in and apply for free healthcare. And there was a link dropped in the chat box with more information on how to apply. Folks can usually do that online, in person, by phone, or by visiting one of our family resource centers. So that information is linked in the chat. That's the Self-Sufficiency website, Self-Sufficiency Services website. However, if for some reason you don't have access to the link, you can just Google Self-Sufficiency Services San Diego or CalFresh San Diego, and you will be able to access more information on program requirements and also how to apply. Chuck, handing it over back to you.
All right, thank you. Lots of great information there. So next we'll go back to Liz, and I'll pull up the questions and we'll start into that section.
Excellent, thank you. Yeah, so this is the time where we'll address the submitted questions that some of you sent beforehand, and also the questions that were submitted in the Q&A box during this telebriefing. I saw some excellent questions come in, and at this point, I'll let Chuck take it over and facilitate the Q&A panel discussion.
Okay, so I'll try to keep this as quick as possible. I will typically read the question out and assign it to somebody to answer, and then we'll try and get as many answers as possible. If yours doesn't get answered, we can try and reach back out to you and give you a specific answer. So the first question, how many victims have been surveyed about their needs to create a county budget memo and programs? And I'll ask Stephen Ray to answer that, please.
Yeah, thank you, Chuck. If you've been affected by the flood, you know there have been a lot of surveys that we've asked you to fill out, everything from an initial damage assessment to local assistance center. I think the most official survey is the one that FEMA provides of the 4,093 folks that have registered for FEMA. We take all of this information as well as information we hear from community meetings and just talking to the victims themselves. And that helps us form the county budget memo and focus our programs to be most efficient and help the most.
All right, next question. How can someone request recovery support on behalf of a property owner? And I'll let Pam from FEMA answer that one, please.
Sure. Hello, everybody again. So in order to help somebody through the recovery process, first thing they need to do is register. Now that registration can be done by a third party like a power of attorney or a family member or advocate. However, once that registration is completed, we do require a written consent form or release of information form to be completed so that you can continue to advocate for that person. And you can get that form either by calling our 1-800 number or going to one of the disaster recovery centers. Again, the first and most important thing to do is get them registered. Back to you.
All right, thank you, Pam. The next question, a little off the current topic, but will you provide support for permanent housing, Section 8 or low-income housing after vouchers expire on March 25th? And I will pass that over to Matt.
Thank you, Chuck. We are working on developing individual housing plans, but as Pam mentioned, the most important first step for all impacted households is to apply for FEMA individual assistance, to see what they are eligible for, so that can be put into the housing plan. The housing plans will also include contributions from our local housing authorities in where the impacted residents are originally resided.
All right, thank you. The next question, what areas have been canvassed for FEMA assistance and what areas are left? How long will the FEMA canvassing last? I'll push that to Stephen. Stephen, could you answer that one?
Well, yes, thanks, Chuck. FEMA has disaster survivor assistance teams, and they're still canvassing the areas, including the sheltering and the hotels. They also have representatives at both disaster recovery centers. As Pam said, that's the best place to register. They're open from 10 to 7, 7 days a week at the Mountain View Community Center in San Diego, and the Spring Valley Library in Spring Valley. And now they'll be open, I believe, till April 19th with possibility of extending that.
All right, thank you. The next question, I don't think we've got an expert on the panelists to ask, but in the form of, we want to be as transparent as possible. I'll read the question and then we'll try and respond back to the person that asked it. That person asked, the storm drains on my street couldn't handle the flooding, which caused a landslide that exposed plumbing pipes. Will the county be evaluating and offering assistance with this? And again, we will try and get you an answer, but we need to get it from the right experts. And we don't have anybody on the panel that can answer that question right now. The next question, will people be asked to move out of hotels this week? Is the county extending their stays and resources? And again, I'll pitch to Matt.
Thank you, Chuck. As mentioned during the presentation, the County Board of Supervisors yesterday authorized additional funding to continue the emergency temporary lodging program. This will now start to take shape on an individual basis as we start learning what they have applied for and received through FEMA individual assistance, what their ongoing needs are, and their current statuses in the program. We do not plan to exit anybody at the previously published date, but we will be working on this as we were just approved yesterday, and we will be getting a message out to the community as soon as the plan is fully developed.
All right, thank you. A couple of more questions we probably don't have experts to answer. One was, how do I get a hotel voucher? And we'll reach out to the person that asked that question directly. Is there financial support available for nonprofits who experience property damage that isn't covered by insurance? And I do know that we have nonprofits getting funding from the San Diego Foundation. Stephen spoke about that earlier. If you have the damage to your home and business, again, as I think almost everyone on the call has said, really, we encourage you to register with FEMA for financial assistance. That is the best way to get the process started. Someone asked, how can I get food stamps? I will pitch it to Esma and Alberto for an answer on that, please.
Sure. So as I mentioned earlier, folks can apply for CalFresh or food stamps via multiple methods. We did drop our self-sufficiency services link in the chat. We do like to make different methods available for community members to apply. That can be done by phone. It can also be done online, in person at one of our family resource centers, or even around the community with one of the events with our Live Well mobile office. So we did drop the link to our website in the chat to give you all of the different options on how exactly it is that you can apply for CalFresh. So we just recommend that you use whichever method is more comfortable or convenient for you.
All right, thank you, Esma. Next question, how can I replace water damaged furniture that might be covered by warranty? So again, we've said multiple times, the best way to start is to register with FEMA for financial assistance. That would start that process and you may be eligible to get some help with that. Next question, are homes and businesses sent a yearly notice to get flood insurance That is not a question that we can answer with experts on this call, but we can again get you the right person to talk to and connect you with that person. So we will do that. We have already answered the question, will prior hotel vouchers be extended and or will a new round of hotel vouchers be available? And again, both of those Matt's already answered at least once, but I do think it's important to realize that we are now moving from the temporary lodging program into a new era where if you're eligible for FEMA assistance, especially rental assistance, then you can get help from FEMA, and that help lasts as long as 18 months. So it's a much more comprehensive program than what the county is on. Can someone verify their identity for FEMA assistance if documents were lost and destroyed? And I'll pitch that question over to Pam.
Sure. So if you've lost or your documents have been destroyed and we have asked you to send in documents to verify your identity, first of all, I want to explain that most people's identity is verified through an automated process where after you register, our computer system uses another system in order to determine whether or not we can verify your identity. If we cannot, we will actually send you a letter with the list of the documents that can be used. Most of the time, people send in a copy of their driver's license and their Social Security card, which you can get replacements through the state and through the Social Security office.
All
Back
right.
to you, Chuck.
All right. Another one for Pam. What proof? Let's see. We did do what proof of flood impact damage is required to receive FEMA assistance? I don't know the answer to that question again. Did you just speak to that or did I miss it?
No, I didn't speak to that one yet. So the way that
Well, Pam,
sorry about that. The way that we verify that you have flood-related damages is we actually send an inspector out to take a look at those damages after you register. That usually happens in about 10 to 14 days from the time that you register. When the inspector is out there, if you have any videos or receipts or pictures of the damage, then they can take a look at them then.
All right. Somebody asked us, is there a flyer with details about applying for FEMA relief? There are actually several flyers. There are several ways that you can do that, and we will reach back out to the person that asked that. But the easiest way to do it, I want to make sure I get this right, is to go online to disasterassistance.gov. That is your first step in applying for FEMA financial disaster relief. The next question, I believe, will be for Stephen. Stephen, someone asked, how do we refer to VOAD or volunteers operating and assisting during disaster?
Thanks, Chuck. And I think this means like registering for VOAD or looking for assistance from VOAD. And you can do that through probably one of the easier ways is to go to the FEMA DRC where we have county representatives to help you. Also, some county folks will be going to each of the hotels that are used for lodging. And then a third way, always a good way, is to call 211 and they can direct you to assistance from VOAD. Thanks.
All right. Stephen, you're on deck for the next question too. What in-person disaster centers are currently open? When are they expected to close? We answered that earlier, but let's go over it one more time to make sure people understand what's being offered. So
the two disaster recovery centers, one is in the county area at Spring Valley Library. The other one's the city at the Mountain View Center. They are opened 7 days a week, 10 a.m. to 7 p.m., now scheduled through April 19th.
All right, thank you. Who should clients report to if they were placed in a hotel but haven't been offered case management services? And we'll pitch that one to Matt.
Chuck, Equus does maintain a general line, and I think this would be the easiest way to reach a case manager. But but they will be contacted on a regular basis. If they have missed the first contact, that's quite all right. Equus will be following up with them. I will place that phone number in the chat.
All right, sounds good. The next one would be for Kat and Maria. Are the behavioral health services at assistance centers and through the access and crisis line only for folks with serious mental illness?
Thanks, Chuck. I can take that. Generally, services provided by the county are available for individuals who have Medi-Cal, who are Medi-Cal eligible and who have SMI. However, if you are in need of care, please contact the ACL and they can provide connection to care-based services depending on your unique needs. So they're definitely the best place and anyone can call.
All right, thank you. The next person wrote, there is a general misunderstanding of the hotel voucher process. What is the hotel voucher process to ensure people's eligibility to stay in lodging is not lost? And I will pitch that to Matt.
Thank you, Chuck. Acknowledge that there has been some general misunderstanding of this project in particular in the implementation of it. But we are underway now, and as stated before, the previous constraints of March 25th that many individuals in the program were made aware of, we will be working on processes moving forward. The voucher portion of it was an effort to transition individuals from our community partners into the county program quickly. That is not the ongoing process, even though that is still a term out there. It is a reservation essentially through a hotel, just as we would book a hotel in our daily lives. Chuck, back to you.
All right, thank you. The next one will be for Stephen. Are there any organizations that will help with furniture replacement? And Stephen, maybe I'll just answer and you can correct me if I'm wrong. FEMA assistance would obviously take care of that. If they were not eligible, they may also reach out to VOAD for assistance. Am I correct on both of those counts?
Yes, you're right, Chuck. And VOAD has working with partners with to try to get more donations. So they've been working with commercial partners to increase the amount that they can provide.
All right, thank you. Matt, another hotel question. What is the deadline to apply for emergency temporary lodging support?
Thanks, Chuck. The deadline to open applications for this program actually closed February 23rd. If you meet the eligibility criteria, it's suggested that you visit one of the disaster recovery centers and speak to one of our staff on site, and they will help you navigate next steps. Thanks, Chuck.
All right. I'm going to skip over a couple of questions and we'll try and get back to them because I know we're running very short on time. The next one I want to address is someone asked, will the dental program with FEMA cover dentures if someone lost them during the flooding? And I will let Pam answer that one.
If you lost your dentures during the flooding, you can ask FEMA for assistance. What we'll do is we'll send you out a letter, and that letter will explain everything you need to send in to us in order for us to help you replace them.
Okay. Someone asked, will FEMA provide assistance to nonprofit organizations? And Pam, I'll let you address that.
So no, FEMA doesn't actually provide assistance to nonprofit organizations. However, the Small Business Administration disaster assistance loans may provide assistance to the nonprofits, and they are co-located at both of the disaster recovery centers. So I would encourage you to speak with the SBA about your needs.
All right, and in an effort to keep us on time, I'm going to read a few questions that have already been asked and try and answer them. And if I make any mistakes, please correct my mistakes. Are families in temporary lodging currently receiving case management services? The answer to that is yes. It says, if not, should we connect with them? And Matt will reach out and get you an answer on that. There's also a number in the chat that you can reach out to for Equus emergency temporary lodging phone number. There's another question on here again about replacement of furniture. I don't have a Red Cross representative on the line here. However, I can get an information on how you can reach out to VOAD, or Volunteers Operating to Assist in Disasters. Stephen can get that number for us, and we can get it in the chat or get it out to those. We also had somebody ask specifically for that number, and so we wanted to make sure and get that. The last question we had that we have not answered is, will today's telebriefing materials be shared? And I will let Liz and her team answer that question.
Perfect. Thanks, Chuck. And thank you to all of the panelists today for your presentations and your Q&A discussion. We also want to thank all of our attendees for joining us. If we didn't get to any of your questions, please, let's continue the conversation. You can email us at lwsd.hhsa@sdcounty.ca.gov. There will also be one more telebriefing just like this one tomorrow, Thursday, March 14th at 5:30 p.m. We'll link the information for tomorrow's telebriefing. It'll be shared in the chat box right now. And of course, always be on the lookout for time-sensitive updates and resources through our e-newsletter and updates. So if you'd like to sign up to receive our e-newsletter, the link to the sign-up form will be in the chat box as well. And today's recording, presentation materials, and answers to these questions will be shared with those who have signed up for our updates. Well, that's all of our time together today. I want to thank everyone for joining us, and I want to thank all of our presenters for their wonderful, timely updates. Have a wonderful day.